Hi and welcome to Triple F's My Experience, Our Experience, where women and young girls share their health struggles. On World Preeclampsia Day, 22nd of May 2020, we talked about understanding preeclampsia, and today we're privileged to listen to the story of a mother who had preeclampsia and postpartum depression.
Hi, my name is Rose. I got pregnant a year after my first child. When I get to the hospital for normal routine checkup, the doctor will say I should go do scan because the baby was really at the lower abdomen. Me when I prepare to go for scan, the scan doctor will say the baby is okay, but what they always say is that the fluid was a little bit low. That should take enough water. When I got to 7 months and we went for a scan, the baby was 1.42. The doctor was really surprised. But then again, he was like, since it's 7 months, the next 3 months the baby can grow more than expected. So I should just try and eat well and sleep well because indeed I was not sleeping. So he gave me some drugs also, and I followed his routine. So when it got to the 9th month of my pregnancy, I went for the checkup. The baby was 3.5, and then after like 2 weeks interval, the baby came back to 3.2. The doctor was like, am I urinating too often? I said yes, I urinate virtually every time. He was like, okay, let's go to test your sugar level. There was no trace of sugar. So the doctor said, there's no problem. Maybe it's the position of the baby, that's why you're urinating for a longer period. The exact day I was supposed to leave, I went to the hospital for normal checkup. The doctor was like, madam, you're in labor. That I should go to the labor ward. They also checked the normal routine check, and they saw indeed I was in labor, that I've already got to 4 cm. I had to call my parents to bring my hospital bag over, and I stayed. So the normal checkup, they always check. They'll check your blood pressure, they check your urine. So when they had the checkup on me, they saw that my blood pressure was very high. So they decided to place me on medication. But before then, they had to go and take a sample of my blood and my urine. When they checked my urine, there's high protein in my urine. This is the child life from the beginning of my pregnancy down to the 9th month. I have never seen protein in my urine, and the doctor was like, madam, you're going to be on for preeclampsia. If we don't stabilize your blood pressure, it might also affect the child. And they gave me a very high dose of an injection that it was as if I was burning up inside of me. I was crying. The nurse was fanning me, and they were just encouraging me that, madam, if you don't do this, it will affect this. Your blood pressure might affect the child. That I should just endure. And they were still checking to see if I would increase in my CM so that I'll be able to push the baby. That medicine actually reduced my blood pressure, and after like 5 hours, so they were consistently checking the heartbeat of the child every 30 minutes to see if it's okay, if it's stabilized, and also to check if I'm dilating. So at a point, the doctor came and said, madam, you're on 7 cm, but the baby's heartbeat is not going as smoothly as they have expected, and my blood pressure is also coming a little bit high, so I should opt out. They gave me an option to go for CS. So I was like, okay, I don't have any choice. I've stayed there for over 24 hours. I was already tired. I was just drinking water. I was exhausted. So when we went for the theater and they brought out the child, there in the theater room, the doctor was like, madam, you're so lucky that you did not push out this baby. If not, this baby would have died, because the position where the baby was, there is no way that baby would have come out. We would have succeeded in turning the baby to an imbecile or something else. That was how the baby came out. And after the operation and everything, I went into depression. I was so scared of me because the baby was so small. The baby reduced to 2 points, and they had to take the baby to intensive unit. I was very depressed after my stay in the hospital. I went home. Anytime I see the baby, it's as if I should just suffocate the baby, let the baby go. But when I think of the CSID, I just remove that thought. I went into postpartum depression. I've always been thinking of how to kill myself. All the procedures, the medicine they were giving me, I refused to take. My brother, who was just encouraging me, every day they come, they make sure that they don't keep me close to the child for that period of time. They always come to carry the child from me, and the baby was not sucking. The doctor said because of the stress, the baby was weak, that it would take time for the baby to suck. So I was expressing this milk for the child. That one too was also another really hectic part for me too. But at the end of the day, after like 2 months to the 3 months, I started gaining back my confidence, and I started encouraging myself also, and the baby survived.
Postpartum depression and postpartum psychosis are real disorders that affect a lot of women. It may get to the point where these women harm themselves and their children. The climax of this was seen in 2001 when a 37-year-old Texas mother, Andrea Pia Yates, killed her 5 children. Pregnancy experience is different for every woman. So if you're a mother out there and you feel overwhelmed or depressed in any kind of way, please talk to someone that you trust and get all the help you need. Thank you so much for watching, and I will see you same time next week, Friday.